Hello, good evening, and welcome everybody here at the webinar and also you watching this recording later on. This is the first introductory webinar for the Finnish Health Data Hackathon, taking place on January 19th and 20th and 21st next year. Well, first of all, big thanks to our sponsors. So we are organized, or HL7 Finland is the organizer of the hackathon in collaboration with other Nordic HL7 affiliates, HL7 Denmark, HL7 Norway, and HL7 Sweden. And we get support from the City of Helsinki, and IHE Catalyst and SensorTrend are organizing and putting a lot of effort into this. And in addition, we have dozens of volunteers making all of this happen. And this is the agenda for today. So first, I'll explain what is a hackathon, and then we'll go more into details about the Nordic Health Data Hackathon series. So this is a Nordic initiative and comprising of many hackathons. And then we go to the details of the Finnish event. So we share information about when and where it happens and which tracks there are, so what you get to hack on, and also the information on how you participate, what does it cost, it doesn't cost you anything, and also introduce the series of intro webinars. So this is the first one, and there will be some more. And regarding introductions, I'm Mikael Rinnetmäki from SensorTrend. About hackathons, essentially a hackathon is a place where developers come together and do cool stuff, mainly program or can even do hardware, mainly connecting their systems to each other's systems and see how they talk to each other. That is the essence of a connectathon or hackathon. So there are many different terms related to this. So there's connectathons, plugathons, projectathons, and whatever. And for instance, in specifications space in HL7 Fire specification, when we create those specifications internationally, we use Fire connectathons to validate the specification. So we invite people to try out what's specified in the specification, and that's called a connectathon. But due to trademark reasons, we are not allowed to call those connectathons in Europe. So it's a bit confusing, but hackathon is the overall concept, and we will be using it here as well. And when we organize a hackathon, the first thing is that we need to have some kind of way to inform people that there is this hackathon, get them registered early, and share some of the information. Okay, what is the hackathon about, and what are you able to hack and get together, and whom you're able to connect with, and so on. And this webinar is part of that activity. And I'm explaining this hackathon concept with some beautiful images from EHIN, Electronic Health in Norway conference by Still Words Photography. So these are captured from the first hackathon of the hackathon series. So yes, you need to get people on board early on. Then at the site, you need people who will be leading the tracks, so track leads. And these are people who are not so much involved in hacking, but they are more responsible for coordinating and helping others succeed in the hackathon. They might still be the best experts of the subject matter and the ones who solve the trickiest questions, but their main responsibility is to ensure that the track goes smoothly and everybody can do what they want to do. So, for instance, in the Norwegian hackathon, we had 4 tracks, and the track leads introduced the tracks and helped all the participants to that. A hackathon is also a great place for specification authors and for system vendors to advertise and explain their specifications, API specifications. So what the specification is for, how you get started with it, why should you care about it, and how can you use it for your benefit. And hackathons also often have some educational content. So it's not just watching bits fly, it's also about people explaining stuff. Hey, this is how I think it should work. And when there is a glitch, when systems don't talk to each other how they should, then you should be able to resolve things really fast because you always have the right people there. So if your client, there's a server, somebody from the server side helping you and help debug the messages and so on. So this is also key part of a hackathon. And in a hackathon, you can also discuss the specifications. So, okay, we know that this is the API specification, and this is how I interpret it, and you interpret it in that way. Let's read what the spec actually says, and in how many ways you can read that and give feedback to the spec authors. Hey, it was possible for us to interpret this in 2 different ways. Or then it's possible to implement the specification in several ways because the specification is not specific enough. And that's also important to realize and give feedback back to the spec author. Technical specifications, of course, always aim to be really clear and unambiguous, but it's really hard to make those kind of specifications because people read things different ways. And hackathon is also a great way for vendors to get feedback on their APIs and implementations and learn of new potential use cases, how people might use their APIs might be widely different from what they've originally envisioned. It's also a great way to connect with stakeholders. And also to other parties. So you might also be a certification body or technical, for instance, here, HL7 Norway is a spec affiliate, and you want to reach out to stakeholders. So that's also part of hackathons, people meeting and discussing it. And optimally, the hackathon leads to meaningful discussions also after the event and eventually bringing integrations into production. And one key thing is still that hackathons are for technical people. So don't send your sales guy to do a sales pitch or to sign a deal. The hackathon is most likely not the best place for that. Any questions so far about hackathons in general? Everybody agrees. Dots. Good. Then let's go to the Nordic Health Data Hackathon series. And this is a bit of history. So this is how it started in Vitalis in Göteborg. Last May, we discussed the Swedish or the Nordic Hackathon that was organized by Health Data Sweden, Karolinska Institutet and Stockholm University. So they did this kind of one-off hackathon last spring, and it was really great. And our table at the Vitalis evening party agreed that, hey, we shouldn't leave this be a one-off hackathon. We need to carry it further and keep the ball rolling. So how about setting up the Nordic Health Data Hackathon series? And this is what we're discussing now. So we had some ideas already in Vitalis that yes, we could make it a quarterly event, so taking place 4 times a year. And this is how it's being realizing. So let's start with Norway in Ihin in November. And then we have Radical Health Festival in Finland in January, Vitalis in Sweden in May. And then we leave the autumn, so the third quarter, to Denmark. We haven't identified the right event there yet. But the main purpose here is to connect it with these industry events. So we know that people have also other reasons to come to city and come to the venue and do some hacking. And that worked well in Ihin in Norway already. So there we had 4 different tracks. And that was good success. Now in Finland, we have currently 2 tracks. You are welcome to propose even more, but the focus currently would be on patient access to health data and on care plans and clinical decision support and computable care guidelines. So 2 tracks in Finnish event. And then we go to Vitalis again, and there we have a tradition of doing some mapping of the Nordic Firebase profiles. So we'll probably do some hacking around those as well and see how they compare with the European base profiles that are relevant for the EHDS and such things. And then also, I think one quite certain topic is terminology, because many of the terminology experts in the Nordics are in Sweden and run the Nordic terminology server there as well. And with Denmark, the plans are quite open yet. So there have been proposals that we should work on patient summaries, perhaps, or perhaps even all of the 5 priority categories for primary use of health data in EHDS. So let's see what happens there. And if you have any ideas, please don't hesitate to reach out. And then to the actual Finnish event. So as said, January 19th to 21st. And 19th, Monday, is the real main hackathon event. And some tracks would like to continue until Tuesday. And then on Wednesday, we have some opportunities to further publicize the results of the hackathon. So this was the reason why we selected those days and Finland as location. So we have the Radical Health Festival. They say that they are not a conference, they are a festival taking place then. And the festival actually starts 5 p.m. on Monday, but we have plenty of time to do hacking before that. And some people might even prioritize the hackathon, stay for the hackathon even later in the evening. But that's one event taking place at the same time. Another event is Lääkäripäivät, so Doctor Days, the gathering of Finnish medical professionals. And they will switch over from Radical Health Festival at the same location, Messukeskus. So Radical Health Festival will be there Monday, Tuesday, and Wednesday, and Lääkäripäivät from Wednesday onwards. And that's not all. We also have the 30th year anniversary symposium for HL7 Finland. And that's also mainly lectures and that kind of content, but also people coming together. We really want to foster random encounters and all of that. So this will be at the same venue, at the same place as the hackathon. So you may join the hackathon and go to see some parts of the symposium and come back to hackathon. So on. That all should be really flexible. And then to the tracks. We have 2 tracks available. First track is the patient access to health data. And there we have many sub-tracks. So HL7 Finland has published a FHIR implementation guide for the Smart App Launch specification. And that is the specification for connecting apps to EHRs. and also patient portals. So app vendors can create apps, and then those apps can be launched from an EHR or embedded within the EHR or from patient portals or patient apps. So this is a way to ensure that this is how you tell the app that this healthcare professional wants to see data of this patient. And in context of this encounter, for instance, you can transfer all of that context information with that specification. And once you do that, then you also get the access tokens, so you can actually transfer FHIR data. So it's an essential part of integrations. And HL7 Finland has developed an implementation guide on that, and would like to see more uptake and get more feedback from that IG implementation guide. The second track is from City of Helsinki and Apotti, a large Epic installation in Finland, and they are still finalizing the actual thought, but what we have been discussing so far is really the patient access to Epic. So they have MySA, the localized Epic MyChart app and portal service. So they'd like to see as many apps as possible integrating with MySA and showing what you can do if you can get your own health data from the EHR. And both Helsinki and Apotti and Epic will be part of that track, helping you make those integrations happen. Then in Finland, we have Kanta, the centralized storage for health information, and they also have opened last year an API for patient-facing apps. So again, app developers can program apps that can then point to the Kanta service and with the permission of the patient get all of their data in structured format. And we have some support available if you want to develop that kind of apps. And we also have EU projects like XShare, and they have the yellow button concept, and that's again patient access to data. So how do we ensure that all of the European citizens get access to their structured electronic health data in uniform format? So XShare is working on the yellow button concept, and we can do some hacking on that. And the final sub-track there is health data and identity wallets. So this is from EU project My Health at My Hands, and also My Data Global has a project related to international patient summaries and identity wallets. So we can, in this track, we want to see how identity wallets play a part in accessing the data and also in sharing the data. And My Health at My Hands also builds the entire chain from the patient through an app to identity wallet and the national contact points, so the EU level infrastructure for health data exchange. And all of that should be available for hacking. So plenty of stuff to choose from on the patient access track. And there are separate webinars explaining some of these. One is already fixed, that's on Monday, December 15th, and that's for the patient access track in general. And Apotti and Epic will have another one. The time is not set, but it's either on Monday or Tuesday. And then on Friday next week, the 19th, there will be the webinar focused on the identity wallets and national contact points. That's it from the patient access track. And there's another track, the care plans, clinical decision support, and computable care guidelines. And there we are still discussing the details, but I would like to have Adam and Jonathan introduce themselves. They will be the track leads. So please do share your ideas of what this track is about. And then I can fill in some other thoughts. Jonathan, do you want to start?
Well, certainly I can start. Greetings and good evening, everyone. I'm Jonathan from Duodecim Publishing Company. We are a I think, the biggest decision support provider here in Finland. And we also maintain and author some of the practice guidelines, for example, käypä hoito, and also more internationally, there is EBMG, which is the evidence-based medicine guidelines. So we do have some experience in this field. The name of the track is long, and I think it could be even longer, or perhaps if you'd like to put it shorter, it's about anything that has to do with clinical reasoning or clinical knowledge. That's my view of it. So if you're working on something that's either you're authoring clinical knowledge or you're implementing that or integrating with that, then that's all in scope. So it doesn't really matter whether that is a care plan or a guideline, or even something like a drug database with like drug-to-drug interactions. All of that is fair game, I think. Would you like to give a short introduction of yourself, Adam, and then I can describe a little bit of the ideas I have for the track?
Sure. My name is Adam Køver. I work in Norway for the Torpelleskatalogen, the Norwegian pharmaceutical product compendium, as a developer. And our main product is drug descriptions and package leaflets on our website, but we are also looking into clinical decision support. So that is why I'm interested in participating in the track. I'm also involved in HL7 Norway, member of the TSD there.
Great. So the major themes or sub-tracks, I suppose, of this track could be something else as well, but the ones that I and Duodekim have in mind are anything to do with the canonical resource management infrastructure implementation guide, that is CRMI in short. That's pretty much the core of anything that has to do with clinical or these sort of knowledge artifacts that one could publish. Traditionally, FHIR has been very much like revolving around instances, and most of the times when you publish something that's going to be an implementation guide, and it's going to contain profiles. But when we are in the scope of clinical reasoning, that's not necessarily the case. And the tooling and sharing various kinds of ways of handling this sort of author knowledge is one place where I'm sure that the hackathon and the collaboration can get much good done. In addition to that, I know that Mikael pointed out that in some of the other hackathons, there's going to be dedicated tracks for terminology. Terminology is a central theme for anything that has to do with clinical knowledge as well. So I'm sure that if there is interest in working on something like for example, the value set compose language of FHIR, or the expression constraint language of SNOMED CT, or any other sort of way of defining and sharing clinical concepts or codable lists would be definitely interesting. That's something that, for example, Duodekim is maintaining roughly 2,000 such concepts. So having ways of better sharing that and making that work both in the local terminology ecosystem and as well as the global one is definitely interesting. For the EU side of things, XShare is also involved in care guidelines. I think it's called let me see. There is a project called the Standards for Sharing Care Plans and Computable Clinical Guidelines, which was kicked off just earlier this month in the HL7 Europe Working Group meeting that was in Cologne. So anything that has to do with computable care guidelines is definitely welcome. And this is, I think, very, very relevant for Europe specifically, because I know that there have already been at least two different ways of like modeling practice guidelines. Some have taken, particularly in Germany, the route of going with the evidence-based medicine or the EBM implementation guide, whereas some others have taken the clinical practice guidelines, so the CPG implementation guide. And so we are already seeing that in Europe there is this sort of diverging. So definitely having more collaboration and some hacking around the concept would help, I think, because we need some sort of cohesive model of doing things. And I think to top that off, one particularly interesting thing to support everything else would be to work on synthetic data. I know that the major player that's been involved in FHIR for a long time now is a tool called Cynthia, which is very much US-centric. And given that we are in Europe, it makes sense, I think, to have synthetic data that is targeting the EHDS profiles. There is already a tool called Cinder AI that HL7 Europe has started, but that's still, I think, very much work in progress. So we could definitely use some hacking to improve the completeness and the correctness and see that data actually in use. What kinds of things can you do with the synthetic data? How can you use that to verify that your decision support system or whatever you're making is working correctly, and that you can prove that it is then like future proof with EHDS. So those are the initial ideas. I'm sure that we will like refine and define this thing more as time goes by, and Mikael will probably help us with that. But that's the general gist of things.
And depending also on other participants of the tracks, if EHR systems are present, then we can also test various APIs for exposing and integrating clinical knowledge and results from clinical decision support, either as a FHIR API or the CDS-HUX specification. It would be interesting to demo showing guidelines in an EHR. And to answer Kari's question or comment on it, it's very relevant for decision support, I think, because the R5 resource, the clinical use definition, is a very good candidate for expressing the clinical knowledge. But it is
can
R5.
You repeat the question from the chat because people watching the recording might not.
Do you see R4 versus R5 versus R6 differences being major issue, especially for medication-related clinical reasoning? That was the original question. So yes, I think these changes in R5, so going from R4 to R5, are very relevant. There is a national recommendation in Norway to stay on R4 and wait for R6 unless people have a specific reason for upgrading to R5. And as a medicinal product compendium, we use the medication definition resources heavily, also in the clinical decision support modules. So that is why we are looking into R5. Unfortunately, we would like to use CQL, but that only supports R4 officially. So then that pulls in the other direction.
Mm-hmm.
So these are also areas we can test on the hackathon.
Yeah, I would definitely co-sign that. And like especially this clinical use definition resource type is one where Duodecim has been heavily involved. And we're not targeting R5 here, but rather R6, because there's been like major changes now that the resource type is finally normative in R6. So there's definitely some considerations around like which FHIR version you should use, and that might even depend on the actual like knowledge base that you're working on. But these are the sorts of things that we could work on in the hackathon, like how should you scope your packages, and how does this thing of versioning resources, how does that like relate to it?
Thank you, Jonathan. Thank you, Adam. I'd suggest that we keep discussing this because SensorTrend is also interested in this track. But let's continue this discussion in questions and answers. I'll rush through the practicalities next. So when and where? On Monday, the hackathon will be a full day at Kuntatalo. You can find the address at the hackathon website, and we will be starting at 9 a.m. already. So if it's possible for you to fly in early or take the train early, and if you're coming from farther away, do consider coming, for instance, on Saturday and taking the night train to Arctic Circle, see some polar lights, and then back on Monday. Finland is beautiful that time of year. So start 9 a.m. sharp. And then some of the international tracks still want to continue on Tuesday. We know that we will have participants who can't make it during the weekend, so they will be flying in on Monday morning and doing some hacking on Monday, but still wanting to continue on Tuesday. And we are currently finding out the best space for that. It seems that that will be in Messukeskus, so where the Radical Health Festival will take place. We are not 100% sure yet. We'll update you on that. And then, of course, the results, there will be published already at the end of Monday. That's the main hackathon day. But then on Wednesday, there's also the opportunity to present what we achieved at the hackathon to the audience of both Radical Health Festival and Lääkäripäivät. So you can reach international guests of the festival and then mainly domestic healthcare people from Finland. And we're able to explain what we achieved and kind of advertise, hey, there are these cool technologies available. We want to take these into production. And that will also be in Messukeskus. How do you participate? Kari is setting probably not EEST. Yes, that is Eastern European Standard Time, should be. Well, is it EET? Anyway, Finnish time, 9 a.m. And then participation, yes, we are setting up the registration page. We were supposed to get it by this webinar. It's not up there yet, but it will be tomorrow. So there will be a registration link on the webinar, on the hackathon page. And what does it cost? It doesn't cost you anything to participate in the hackathon. And also the other way around, you're not paid to participate. Some tracks may have some prizes, challenges and prizes. None of that has been confirmed yet, but in principle, no money changes hands regarding the hackathon itself. Radical Health Festival, if you want to go there, you need to pay a registration fee, and also Lääkäripäivät is for paid members only. But for the hackathon, no registration fees. And then again, thanks to our sponsors, both monetary and sweat support is highly appreciated. And now would be the time for questions and answers. Are there any from the audience? While you're still thinking, I can kick off by explaining sensor transposition on the care plan track. So we have care plan for diabetes patients, and that takes the established treatment protocols in Finland, Käypä hoito, as Jonathan mentioned, and formalizes that into an app so a patient can see what they're basically entitled to. And then you have some parts for the healthcare organization so they can see where the biggest treatment gaps are, which is the population that has not been given treatment according to the guidelines and recommendations. But we'd really like to not do all of that ourselves. So if Duodecim, for instance, has a beautiful structure of that Käypä hoito suositus of those recommendations, we'd be more than happy to plug into an existing system and read those definitions from there. So that would be our main target on the care plan track. And of course, everything that's related to that, like terminologies and computable care guidelines, all of that, we just need to learn about there. So please be prepared to do some educational content as well.
Yeah, certainly. I'm sure there's going to be some hacking involved from Duodecim's side as well, because, for example, Käypä hoito Assist's entirety is quite far from being computable or machine readable currently, but that's definitely the direction that we are going in as well. So good to hear.
Any other questions? I would give it some time, and then at some point we can turn off the recording and then still discuss with people who don't want to be on the recording. Is anybody from the current audience brave enough to introduce themselves and explaining what they would like to achieve at the hackathon? Or what brought you here? Michael, I show you put on your camera.
Yeah.
But we
We
can't
are
hear
small.
you.
We're a small audience, so sorry. It was a colleague who left. No, my interest in this meeting, I just found out recently that this was taking place today. It's because we from the Danish side participate in NextShare and also share care plans, but our situation is that they are stored in CDA format, and we need, at present time, we cannot collect data in a FHIR format, but that's a task we will have to implement early 26. So the topic about how to produce a FHIR care plan is highly interesting for the XShare project, and we have a small company from Denmark called Medic, which are actually the adoption side in XShare about this, and I have forwarded this invitation to this meeting to him today, but he has not been able to see it. But I will brief him afterwards and suggest him to travel to Helsinki and we will discuss this with the Catherine, who's the technical lead of the XShare project as well, because I think it's important that he participates in the hackathon to learn how to map from CDA to FHIR the optimal way.
Yeah, that's another topic that's highly interesting for us as well, because also the Finnish national infrastructure Kanta is CDA based, and we want to take data from there and transfer that to FHIR. We do some of that already.
Yes, and I also found this meeting interesting because earlier today there was a FHIR meeting in Norway, and they also talked about the care plans and the development of care plans in Norway. So it seems like in multiple countries we can benefit from sharing knowledge and developing together.
Yep. Most likely to become the 6th priority area for EHDS.
Yes, could be a good idea.
Morten, do you want to introduce yourself? No pressure. About Mikko?
Hi, Mikael. Hi, everybody. I'm Mikko Tionen from Forsanti. Sorry, I've been quite quiet because I have been attending this from my car and driving home, and I'm still on the phone here, so no video because of that. But yeah, well, basically we've never been in these hackathons, and we are very enthusiastic to participate, and I'm hoping that tomorrow maybe, Mikael, we can have a discussion on what specific targets we do have in this when we are doing it together.
Yeah. So we have some preparatory calls for the care plan track, and that was originally set up by SensorFriend and Forsante and Duodecim. We thought that we are all working on care plans. We should do some hacking together. So that's why we are still also discussing amongst ourselves. But yes, let's fix the details and let's also get the actual webinar for that track set up.
Yeah. Thank you, Mikael. Looking forward to that.
Thank you, Mikko, and drive safe. And Morten explained that he doesn't have audio currently, and also Kari is text output only. So Howard, would you like to share your views?
Yeah, I can say a few words, and I'm here kind of representing Norwegian Contair and Estonian Industry 62 that recently bought a share of Contair. And of course, this is a very interesting area for us, and we're currently working on activities both in Estonia and in Norway, and of course also some in Sweden, but not that much in Finland. So maybe we could use this as an opportunity to maybe bring some of our colleagues both from Norway and Estonia together, and also at the same time get to know a little bit more about the Finnish activities going on in this area.
Yeah, certainly seems that Finland is the missing piece. Could make the connection from Norway to Estonia easier.
Yeah, so hopefully we can get a few guys to participate and meet up in Helsinki.
Excellent. Thank you, Howard.
I had the pleasure of working together with Contair before in Norway, so then there will probably be some more familiar faces.
Hello, everybody. I'm Samuel Rintmäki, twin brother of Mikael, and I'm probably joining to work on the patient data in digital wallets. So we have a project going on related to patient data or the international patient summary as a digital credential in a wallet that a person could share in case of emergency abroad. So maybe that's something that we will advance during the hackathon.
Thank you. Any other ideas, concerns, questions? Did this webinar fulfill your expectations? Howard is nodding. Good. There will be many other webinars as well. I think I'll stop sharing and thank everybody from the participation so far, and I'll stop the recording and still be staying on for other discussions that you'd like to have that are not recorded. But for anybody looking the recording, bye-bye and see you at the event.